Hi everybody, back in San Antonio. I don't do this often, so I'm just going to try and wing it and just kind of give you a I don't know, a play-by-play blow of what's going on up here in New York. Let's see, I started working at, it's called New York Presbyterian Hospital. They've got several hospitals at the system here in New York, and I'm at the Lower Manhattan location. Um, I I finally, after being here since last Sunday, today is Sunday, so I started up in Massachusetts. They were having a problem with a temporary license. The state was having a problem with their temporary license process, so I was unable to get a temporary license. And Tuesday was there, and money was only going in one direction, and that was out. And so I started getting responses from people that I had checked with the previous Friday on Easter. I guess that was Good Friday. And a couple of places got back with me and told me they had locations in New York that they needed help. So I came over to it was called Westchester, New York. This same system had a location up in Westchester, or Elmsdorf is what it was called, probably about 30 miles from here north. And I am on, I don't know if Manhattan is an island, or I don't think it's an island. It's more like a peninsula. Anyway, I was up there for 2 days, 2 nights, and then I found out that I had been sent to the wrong hospital. And so I had already checked out where the hospital was. It looked like, it said that it was a psychiatric or a behavioral center. And that might have been okay for my treatment. But as far as COVID patients, I thought that something was wrong. And turned out that I was right. It was wrong. And so after a couple more wasted days, I found out that I was supposed to be here. And that was at the New York Presbyterian Lower Manhattan location. And there's another one called Weill Cornell. It's a New York Presbyterian hospital, part of the system, only about 3 miles further up north in here on Manhattan. So anyway, Friday, that was Thursday, I changed hotels again, and I came down here because thanks to the AARC, who other people have badmouthed about training nurses and to run ventilators and stuff like that, the AARC has a program with the Hilton hotels here in, I don't know if it's throughout New York, but I am able to stay free now. I'm booked until I think the first week in June, staying free in a Hilton. I was staying in Extended Stay America, which had a kitchen, a full-size refrigerator, so I bought some groceries, but now they're in a mini fridge, and I've got to try and I'm probably going to throw them away because I've got some perishable stuff in there, some meat and stuff that I can't cook anymore because all I have is a microwave here, so I got to go buy some paper plates if I want to eat the stuff. Anyway, long story short, I am staying free in a Hilton location in Lower Manhattan. It's in the financial center, so I am almost at the very tip. It's called Battery Park. Is just on the other side of these buildings. I'm going to give you a shot here real quick of what I can see from my hotel room. It's pretty cool. Anyway, so I'm staying here free for 4 or 5, 6 weeks, whatever. And thanks to the AARC, our professional organization, that I'm not going to talk bad about because they're helping me out with this. So I'm actually pocketing about an extra, depending on the hotel that I was staying at, $1,400 to $2,000 a month that I was having to pay for hotels. I was going to get reimbursed anyway from the company I'm with, but this is one of the things. I don't know. It's kind of a kind of a catch-22. You know, this is a crisis for the country, and it's apparent. And I was seeing the scope of things. You know, it's happening down in it was happening down in Texas, but you heard that all the death was here. And so what's sad to see is, as I drove up here, and as I traveled through states, anytime I'd stop for gas, man, everything was, well, there just aren't very many people out. So I was starting to see that this is really nationwide, and everybody is suffering with this. And I'm going to get to the part up here in a little bit. But so I was starting to see the scope and just the depth of what this virus is doing to our country, and around the world too. Of course, we only hear about that on TV. Anyway, so I got to my hotel on Thursday morning. I left that previous hotel because I booked this room starting Friday night, and I had an orientation at this New York Presbyterian Hospital, this location, on Friday morning. So I packed up on Thursday night, except everything I needed to take a shower and stuff and get dressed, and came at 10 to 6 in the morning. I had already been down here, checked out where I had to go, how I was going to get my badge so I could go to orientation and all that stuff. And I got down here Friday morning to go to orientation, and everything was in my truck. I parked in a parking lot, and let's see, at the end of the day, at the end of orientation, I came here to the hotel, checked in, and this is where I'm staying now. So I've been here for Friday night, and last night, Saturday night, I did orientation a full day on Friday. And it really wasn't even all the orientation stuff that you go through when you get a job in respiratory in a hospital. It was just showing us around I was being orientated with one other person that was here from Dallas. And so they showed us around the hospital, showed us equipment room, showed us the unit, showed us everything. And let's see, there was a point that I was going to make, and it'll come back to me. Anyway, so now we'll get into the hospital. So when we went into the unit, like any hospital in San Antonio, the hospital that I was working at when I came up here, you have to wear a surgical mask from the entrance the whole time you're in the hospital till you leave. Except in our department that's closed. It's our room where we get to go and, when we have a little bit of downtime, hang out and stuff, so we don't have to wear a mask in there. But let's see. The first time I realized not only that this was happening countrywide, but that the death is real is when I went to the unit. And so 3 weeks ago, we were supposed to, they kept on saying, man, y'all needed to be here 3 weeks ago, because when we went into the ICU, it's only a 20-bed ICU, but they had single patient rooms or single patient cubicles with glass doors, sliding doors and stuff that were being used for 2 patients. So the day that we did orientation and walked through everywhere, they had 19 vents in a 20-bed ICU, but several of the rooms were doubled up. So you had 2 vents, COVID patients in single rooms. We passed one room, and I didn't know the patient, but the girl that was orientating us, the clinical coordinator, was like, there was a patient in there that was no longer, and she was covered up. And she's like, oh, so-and-so died. And one of the nurses was like, yeah, she died about an hour ago. And it was just kind of hard to see. And it made it real that this stuff is happening everywhere. But this is like the place. They're not nearly as busy as they were 3 weeks ago. They said they could have really used our help 3 weeks ago. because now patients still come here. Yesterday, so I got that day of orientation yesterday. I worked in the unit. When we go in there, we're told to treat everything as if it's contaminated. So you touch anything, you Purell. That stuff is all over the place, and you're doing that many times a day, and washing hands, of course. So when we go into a COVID room, let's see, I only shadowed yesterday, so I only took care of 3 of the, there were 16 vents yesterday, so the person that I was shadowing had 8 of the vents, and then the other side had 8 vents, and was taking care of NICU, which they've got a very small NICU here, but I was like, y'all don't have to, y'all are allowed to go in the NICU after taking care of these patients. And so here in this hospital, you can take care of COVID patients and take care of the NICU also. So that was, it's called the low side. Not as acute, even though there are patients on vents there, but that person on the other side of the unit takes her side. It was a girl, and she took the NICU. Anyway, so when we go into patient rooms, COVID rooms, they are of course closed, you know, the doors closed. They're all negative pressure. We wear a bonnet. We wear, you know, the head surgical cap. We wear our duckbill. You only have to wear, they only say it's okay, they say it's okay to wear just a surgical mask in the unit. But when you go into a patient room, and it's us and the nurses, the docs, they've got like an iPad. They've got PAs working in the unit, but not going into the rooms. And they've got an attending on the iPad, and then they'll go up to the room and show the patient to the attending, and then they get orders, and then we're the ones that go in there as, you know, as usual. We still don't get mentioned on TV a whole bunch. It's the nurses and docs, but the doc stays safe outside the room, or the PAs, and it's the nurse and us that are in there. When they have vent changes, they call us, so we go in there. Right now, normally vent checks are Q3 here, but right now they say you can go in there 1 time a day, 1 check in a 12-hour period. So what we do is we go in there, and so I was getting back to how we don protective equipment. So it's the gown, the yellow isolation gown as usual, gloves. We've got our duckbill on. We've got a surgical mask over the duckbill, so we can go from room to room and just change the outside, you know, the surgical mask, and leave the duckbill on, which we've already been fit tested here for. And then you've got the bonnet, and you've got what they call a welder's mask, which is the face shield that's thickly padded for your forehead, and then it comes down and it doesn't come over your face. Or you can wear goggles. I brought glasses in case, well, you don't get coughed on really. Everything's closed, of course, on vents. We do have a lady that's a COVID patient, and she's still on high flow. So whatever she's exhaling is coming into the room. So that's how you're exposed there. Anyway, you go in with her. It's just checking her out, listening to breath sounds, stuff like that, a quick assessment, and getting heart rate and respiratory rate and stuff like that. She's very, not lethargic, but just sickly looking, but she isn't intubated yet. Maybe when I go back on Tuesday, she'll be intubated. I don't know. But anyway, then I was helping take care of 8 patients. So I was following the therapist that was showing me his process and what he does with each patient, and going into the room. And so when you come out, you of course remove everything, not your masks or your face shield, and you just remove the gown and gloves. You wash your hands in the room, use your paper towels to slide the door open, go out and close it, and then Purell and all that stuff. And then you go to the next room. and then you're doing vent checks. We did not, even though they have cows here, we use, I forget the name of their system, their software. Anyway, we print out sheets on each patient when we're in the department in the morning. I'm working days here because I don't get night shift differential, so I'm working days. Anyway, we print out the sheets that tell you their history and some stuff, lab values, ABG, stuff like that you need to know, and that you have with you all the time on all your patients that you've got. And you just write down everything that you need on that sheet. And then you just go from room to room and you get all your numbers. Some of the vents download automatically to the computer when you do what you have to do. They're attached to the 840s. Oh, and they use PB's, Puritan Bennett 840s here for all the patients. Plus we've got, when they were really busy, we're not using them right now, but when we were really busy, we have, I think, 24 LTVs that were given to us, given to the hospital by the government from the stockpile when they were super busy and they needed more vents. So those are down in the basement. And I talked with Christian. I think I'm going to try and get some shots. I don't know if I can go take a video down in the, I can't, of course, do it in the ICU of patients. It's sad. Yeah, man, I keep on. Sorry, I don't normally do this, but it's just sad that all these people are dying. It's finally flattening out here in this city, but it's still happening, man. People are dying every day. So I don't know, when I go back on Tuesday, I'm sure some more people will have passed that I was taking care of yesterday. Anyway, it's kind of a drag to see. And I'm not an emotional person, guys, and I've been doing this, it'll be 31 years in August, but it's just sad that all these people belong to families. Some don't, but, and this virus is real. So you got to take care of yourself. So if you're not taking it seriously down in San Antonio, I think I saw a story on the internet that y'all are having to wear masks everywhere now down there. I don't know what the hospitals are looking like, or if it's becoming more prevalent down there, but take it seriously. Just take care of yourself. Don't get sick. I hope I don't. Of course, I'm in a high risk area, and I'm gonna say this. Oh, I know what my point was. In my 30 plus years, you don't see an opportunity like this. And this was also an opportunity not only to come up here and help and use what I'm trained to do, but my reasoning was, I was down there in San Antonio. We never really, I think there was always talk that there might have been a COVID patient in our hospital and at the hospital I was working at, but it was never for sure because it was all kept secret. So I thought, if I was going to be taking the same precautions and taking care of the same kind of patient down there for my money that I was getting down there, I was going to come up here and make almost $6,000 a week to do it, and really be exposed and take my chances, because that's what I was going to say. It's like a catch-22. You don't want it to happen, but this does not happen and never has happened in my 31 years in respiratory, where this is how dangerous it is here, that hospitals are willing to pay that much to have help for the staff who were getting slammed with their regular staffs. And so now we're here to help. Anyway, take care of yourself, take it seriously. It's real. People are dying. And that's all I can say. I will say, I'm not a doctor, but I don't know, in this hospital that I'm working at, they're using volume ventilation, high rates, low tidal volumes. They're kind of using ARDSnet, but they're using it, instead of using pressure ventilation and APRV, which I think would benefit these patients more than volume. They're kind of using ARDSNet protocol for the tidal volumes, but then using volume ventilation instead of pressure. But of course, that's a doc's decision. So, but we're the ones that, when gases are done, we're the ones in there drawing gases. Most of them are on A lines, and the nurses are the ones that get the gas, the blood here on A lines. And then we'll find out if the doc wants changes or the PA wants changes off of the gas results. So they call us and we go into the room, you have to get all gowned up again. So that's kind of a short thing, you know, not short, that's my little story. And like I said, I'm sorry about this. I don't do videos. I haven't done this. So I don't know if I'm going to try and I'm going to look at YouTube and see how hard it is to move this from my phone that's on a tripod to YouTube. I don't know if it can be done. I'm sure somebody out there could tell me. Anyway, by the time you see this, it's either going to be on YouTube and it's going to be a link, or I'm going to send this video to, I don't know, Christian, and he'll probably get somebody else to do it, or I'm going to talk to Mr. Parsh and see if he can tell me how to do this. But anyway, this is, let's see, 21 minutes, 21 and a half minutes. I didn't think I could say that much. But anyway, I'm going, oh yeah, I was going to show y'all this. I'm down at the tip of whatever Manhattan is. If it's an island, I don't think it's an island. I told you, I think it's a peninsula. Yeah, anyway, so I'm going to take right outside my window. I'm on the 8th floor, and I'm going to show you over here to the left, down below at street level, there's the Staten Island Ferry where you can get on the ferry. And I think what I'm going to show you in the background is Staten Island over there. I'm not sure, because I was going to ride the ferry, but and I've also gotten some neat shots. The hospital that I'm working at was in the shadow of the World Trade Center. It's an old hospital. They shut down. I'm in the financial district, so that's the Hilton I'm staying at. Wall Street, I'm going to go check that out and take some pictures, is only about 5 streets north of here. Times Square, I don't know, the guy, one of the guys at the hospital said I could ride a train from down here. I don't know if I want to get on a train, but you can ride the subway up to 46th Street. So I'm down here, I don't know, it's like 3rd, 4th, 5th Street, right around here. So it's many blocks. I am walking now. Parking is phenomenally expensive here. So it cost me like $34 in a parking lot that I thought was supposed to be free for hospital employees. I go to get my car or my truck out of the parking lot, the parking garage, at the end of an orientation day, and they said I had to pay. They said I had to pay $34 to get my truck, and I went off, man, because that isn't what I wanted to hear after that day. The guy was coming back at me. It's like these New Yorkers are bold, and they saw how bold I was. Anyway, I just said, get my blank blank truck and get it up here. And I paid the $34, and I was going to take it up with somebody. I think I was just blowing off steam. But anyway, what I did was found a parking garage that cost $500 a month, and I can take care of that. $500 a month, it works out to like $16 a day, and I'm keeping it parked because the hospital is like 0.8 of a mile up the road, well, from here, and so it's a 15-minute walk. So yesterday, for my first day of work, I left my truck parked all day, and I just walked 0.8 of a mile. It takes like 15 minutes, and I'm there at the hospital. And then after work, I come back, you know. So I was going to walk around down here, and I know I passed Wall Street, so I'm going to check out Wall Street. I'm going to probably go over here to this Staten Island ferry that I'm going to show you, and see if you can walk across. I mean, we'll get on the ferry as a pedestrian and go over there to Staten Island, and see what's over there, because haven't been down. I was here when I was like 3, 4, 5 years old, I believe, when my dad in the Air Force was getting ready to go over to England. So I don't know anything about this place. So anyway, a lot of people ride bikes. This is a very, very vibrant area. It's sad to see all these cool little restaurants and bars that are just, it's like a ghost town. There are people out today because it's finally stopped drizzling and raining, and it's sunny. It's still probably in the low 50s right now. So, and there's like a brisk 10 to 15 mile an hour wind. So when you walk outside, it's cold, to me anyway. Yeah, but there are people running around in shorts and all that stuff. You know, people that live here. There's a bunch of bikes it's called City Bike. And I'm thinking I might just rent one of those. You got to do it online, where you can ride a bike someplace and then just leave it. Kind of like, I think we have those we have stuff in San Antonio like that. Anyway, my point was very vibrant. This is like bustling down here. And I came across 2 people on my walk to work. I left at 6:30 in the morning, had to be there at 7. It's a 12-hour shift, 7 a to 7:30. I left at 6:30, got there at like 10 till, or a little bit more, and I ran across 2 people on the street on Saturday morning at that time in the morning at like 6:30. So that's how dead it is down here. Everybody has to wear a mask everywhere. You're supposed to wear a mask everywhere on the street, but you know, there are so few people, and it's kind of windy down here in the buildings that yeah, anyway, you're supposed to wear a mask. Oh yeah, I was going to say the hospital was in the shadow of the Trade Center. So one day I might send a picture, but I was working. I said, Orlando, where is the building that they built in place of the Trade Center? And he goes, it's right out here. And so you walk out the front of the hospital, walk 1 block to the right, south towards my hotel. And he said, just turn your head to the right, and it's right there. And so I've got this awesome picture. Well, I saw it, and then I kept on going across the street. But then there's so few cars that I went back out in the middle of the street and took a picture framed by the buildings on both sides of it's called the Freedom Tower. And it's what took the place of the World Trade Center. And it's like 4 blocks away, but it's right there. And it's like, wow, that's cool. So anyway, took a picture. I'm going to go take some pictures here because it's sunny outside, and it's supposed to get up in the low 60s. So it's cold in the shade because I already been outside. It's cold in the shade, but it gets kind of warm just walking in the sun, but the wind is still blowing. So anyway, sorry I've given you so much background and story and all that stuff, but the thing you've got to know, man, this is what you're going to school for, and you may never get to see this. Hopefully you won't get to see the bad side of this in your lifetime again, this kind of crisis, because there's a lot of suffering and a lot of death that go along with it. Usually what it seems to be at this hospital is they say once you're on a vent, you don't come off until you pass. So I haven't seen a lot of that because I was only there 1 day, but I did see on my orientation day a lady that had been on a vent and had passed away, and she had only passed away an hour before. So this is what we do. This is something that I've never seen in my lifetime, and of course Mr. Mangus has probably seen it, but this is sad, but it's an opportunity. It was an opportunity to me at the same time, so I wanted to jump on it. I hope I don't get sick, and I might do a couple more videos. I'm going to see what I can get away with in the hospital, doing some video maybe and sending it to y'all, because I'm sorry I wasn't there on Friday like I was supposed to be, but I was in orientation all day long Friday. But I'm going to try and be off. I think Mr. Baker told me there were 3 more days that I have to be there on Friday, so or on the Zoom meeting. So I'm going to try to have those days off, and maybe bring you a couple more of these videos. I don't know what I'll do. This was impromptu, kind of ad lib, so I'll see what I can't come up with here for the next videos. And I keep on sidetracking. I'm going to show you real quick outside my window if I can figure out how to make this camera go to the. I thought I could make it go to the other. Wow, I thought. I don't know, guys. Maybe maybe I should have started. Well, I don't know how to make the camera go so it's pointing the other direction. So I've got the little camera thing that I touched, and so it's pointing this direction. But now I don't know how to make it go the other direction, because when I touch the screen, yeah, it doesn't come up. So anyway, well, I'll have pictures. So if I make it out of here alive and make it back to San Antonio, I will I'll show pictures to anybody who wants to see them. It's pretty cool up here. What's sad, though, is that I'm in a place, I'm here because of this crisis, and there are a lot of attractions, a lot of things to do that I can't do because of why I'm here. So that's the catch. I probably wouldn't come up here. It's very expensive. Everything's expensive. So finding out, we're paid, with my experience, I'm paid probably about $20 an hour less than somebody with my amount of experience up here. But you pay everything. It's just nuts. Let's see. Oh, well, $32 and $34 for parking a day is expensive. That like made me go off. So that's expensive. I'm trying to think of some stuff. Gas, when I left San Antonio, was $1.19 in Universal City, where I live. I don't know what it is now, but up here, when I got here, it's like $2.59. If you pay with cash. If you pay with a card, it's $2.69 a gallon. So it got more expensive the further north I drove. So there is no less than $2 gas up here. My point is, yeah, we commensurate to what expenses are. If we could make what New York therapists make down in San Antonio, we'd be doing much better. That's all I can say. Anyway, guys, that's all that I guess that's all I got to say. I'll think and I'll watch this probably before I try and send it, and see if there was anything else that I could have thought of or said. I think I got across the important points. Treat everything, well, it's hard to get used to, but when you see that you can get sick and die, it's making me use Purell or the little hand things everywhere much more often, and wiping everything down. Treat everything like it's contaminated with this virus. We still don't know a lot about it. I think they're finding out more every day. But take care of yourselves, and be careful. And I hope this has been something that you can use. I'll as I find out more. I've told you they use volume ventilation here, and high rates. IE ratios close to 1-to-1. And that's why I was like, why don't y'all use APRB? Why don't you use the PRBC? We've got some Siemens, not Siemens, those The other, the 900. Anyway, I can't think of the ventilator name. But I think these patients might do better on pressure control, or APRB, where you can wean them down that way using pressure and high and low times and high and low pressures. But they don't do that. So anyway, that's all I can say. I told you about how we use our the protective gear here. We've got plenty of it, so they may have been short at one time, but there is plenty of gear. I've got my own safety glasses that I wear, and then I wear the I think I told you they called it the welder's mask. It's that thing that comes over your face. It comes probably to about right here, and it's probably about this, yeah, there's a big cushion up here, and then it comes down to like right below your chin. And I wear that over my, my glasses. We use the duckbill N95s and then the surgical mask over the top of it, so that we can get rid of the surgical mask when you go into the next room. The way they're doling out the N95s is wherever you're working in the hospital, there is only one unit. It's the ICU. It's a 20-bed unit. That's where the military came in here and made the PACU, which is like 8 beds. They converted it with plastic and made all the rooms negative pressure and zipper to go in and out. And there's meters, negative pressure manometers, I guess you would call them, on the outside. So there's like a piece of plexiglass embedded in the plastic somehow. Anyway, that part is not being used. But 3 weeks ago, when they said they could have really used the help then, but yeah. So we weren't here. Shoulda, woulda, could have, but that's the way it is. But anyway, so there's an 8-bed PACU that's been converted by the military and by making it all into negative pressure rooms, and it's kind of overflow that they needed 3 weeks ago, but now census kind of dropped. But we still get COVID patients. There was one being set up in ER right at shift change when I left. That was going to go on high flow down there, and then they try and take care of them on high flow, and hopefully they get better. But usually once they get intubated, and they've had a couple of 40-year-olds or people in their 40s, a couple of 50 people in their 50s. This doesn't discriminate. They did say they had parents that were both COVID positive that had a baby. The lady had a baby, the mother, and it did not pass across the placenta. So the baby came out clean when both parents were contaminated or were positive, COVID positive. So maybe it's from God, who knows? But somehow a new generation is being, that probably doesn't say that babies can't be infected, but a generation is being saved, because if it wiped out babies, man, that would, excuse me for using that kind of language, if this virus wiped out babies, it would take care of a generation. So that is a positive. Okay, I can't think of anything else to say. I hope this is of use to you, and I hope you I hope this has only generated questions for you. I know if this was a Zoom meeting, I'd be getting all kinds of questions from a couple of people. But thank goodness this is only going one way. So y'all will get to watch this, and I'll probably either communicate still through Mr. Baker or Mr. Parsh, and I'm going to try and have Fridays off so I can be in the Zoom meetings. I think there are 3 more Fridays in this semester. Learn everything you can, because when when it comes down to this, all I can say, and I guess all you can, probably the best thing I can say is respiratory therapy is respiratory therapy, no matter where you go. So the care is the same. So that's why it was just a 1 day of orientation, showing us where equipment rooms were and where we get stuff, getting passcodes to get into equipment rooms, and then learning the charting system, because the charting system, the office part of our job, is the hardest part to learn, because everybody has a different program, a different software program, and I can't think of what this one is called here. But once you learn how to navigate, they all do the same thing, kind of like driving a car. So they'll all get you to some place, but the controls may be in a little bit different area. So that's respiratory therapy is respiratory therapy. That's what you need to learn. That's what you're in this program to do, is to learn this stuff, and learn it well while you can. And then once you get out, hopefully you can use it and be effective. I think I've told you all the people that have been with me. Oh, I think I've told first year in a PowerPoint presentation. Or yeah, treat everybody like they're your family member, because there are plenty of therapists that don't. There are plenty of therapists that like to shortcut. The guy that I was with in orientation, don't want to slap him. He's not here to defend himself, but I guarantee you he would, because everybody that doesn't do what they're supposed to do will defend it somehow, or justify it one way or another. Do what you're supposed to, because there are plenty of people that don't. And as long as you can go home and you've done everything you can to help these patients any way you can, hopefully one day, if it's you in the bed or if it's a family member, they'll have people that will take care of them the way you chose to take care of them while you had them as patients. There are just so many. Some of these well, it seems like early on in the process, once you get intubated, there are not a lot of secretions. I heard a lot of what sounded like clear breath sounds, but we're not producing a lot of secretions when you suction them. Even lavaging them, not getting a lot of secretions. But as the disease process progresses, they start producing a lot of secretions, and you suction a lot out, a lot. There were a couple of patients. Of course, I don't know. I didn't research to see if they were, COPD. I just know that early on, even though their X-rays will show kind of like a ground glass appearance, whited out, it keeps on getting worse. This is it's just a bad pneumonia that can't be that very few people recover from once you get put on a ventilator. So I can't say much more than that. I guess that's about it. And if I could make this camera turn around, I'd show you a pretty cool view, because there's water out there and everything. I guess there's like 2 rivers that come on both sides of this peninsula. And then Staten Island is over there. I think that's Staten Island right over there. And because the ferry is right down at street level, about half a block, you can see it says Staten Island Ferry on the front of the building and everything. And anyway, guys, we'll see if I can't put together a couple more of these things for my next Fridays, and see if I can't have those days off. They're kind of using us. There's 4 of us that are travelers here that they're just using to put another person in the unit, because right now they've been running the unit when they were busy with 30 plus ventilators in 20 rooms. They only had 2 people, and they were running their butts off. And so now things have flattened out. That doesn't mean it's over. That means that right now it's a little bit less, so they're getting a breather. But they hired us to put another person into the unit so that there are 3 people splitting the load instead of just 2, because the people that work here, the staff people, are they're exhausted. They've been working their butts off. There are hospitals here in New York that are worse than this, but they're all taking care of these patients. Anyway, I'm here to do my part, and I will try and bring more to you again later. That's it from Lower Manhattan in New York. Thanks for listening, and take care. Bye-bye.